Hi everybody, Miss Morgan here. In this video we're going to be discussing normal thyroid anatomy, and this is going to include the description and location of the thyroid gland, the surrounding musculature, and also the vascular supply and drainage. The thyroid is a gland that's located in the neck. It sits anterior to the trachea. It has two lobes, right lobe, left lobe. Both of the lobes should be about equal size, unless you're Jordan and you have a wonky left lobe. But for the most part, normally they're going to be about the same size. These lobes are going to wrap around the trachea and the esophagus laterally. And this little piece here that connects the two lobes is going to be referred to as the isthmus. Sometimes there may be a small finger-like projection that arises up from the isthmus, tapering up superiorly. This is called the pyramidal lobe. This is just a normal variant. It may or may not be present, but it's just something that you need to be aware of. On the posterior aspect of the thyroid, we have our parathyroid glands. Most people have 4 parathyroid glands, but it is possible for it to vary. You can usually have anywhere from 3 to 5. And in addition, with how many parathyroid glands, they can also sometimes vary in location. But most of the time they're going to be paired, 2 on the superior poles of the thyroid, 2 on the inferior poles of the thyroid. So looking at the posterior aspect of the thyroid, we have our parathyroid glands here. They're going to be flat and disc-shaped. They're normally going to be less than 4 millimeters and isoechoic to the thyroid parenchyma. Actually so isoechoic to the thyroid parenchyma that they're not routinely seen sonographically, usually not seen unless there's something wrong with them. For our normal thyroid measurements, we're going to use length as being 4 to 6 centimeters, our anterior posterior height as 2 to 3 centimeters, and transverse, our width of each lobe is going to be 1.5 to 2 centimeters, and the isthmus 2 to 6 millimeters. And again, like we were saying earlier, parathyroid is going to be less than 4 millimeters if you're able to see them. So that's an overview of the location and a brief description. Not too bad so far, right? Okay, so let's move on to vasculature. Blood's going to be supplied to the thyroid via 4 arteries. The first 2 are going to be the left and right superior thyroid arteries, and the second 2 are going to be left and right inferior thyroid arteries. Easy enough, right? So the superior thyroid arteries are going to arise from the ECAs, the external carotid arteries, and descend down to the superior poles of the thyroid lobes. The inferior thyroid arteries are going to be seen here and here, and those are going to ascend up and feed the inferior portion of the thyroid lobes, coming off the thyrocervical trunk of the subclavian arteries. For drainage, the thyroid relies on 6 veins. The first is going to be a paired left and right superior thyroid vein. We're also going to have a left and right middle thyroid vein. Both the superior thyroid veins and the middle thyroid veins are going to drain right into the jugular vein. And the last pair of veins is going to be, as you can probably guess, the inferior thyroid veins. And these are going to drain right into the innominate veins, left and right. I think all of the vasculature of the that supplies and drains the thyroid are very appropriately named. I appreciate that about them. All right, so let's talk muscles. I'm going to break them up by anterior and posterior muscles. So the first anterior muscles we have are going to be referred to as our strap muscles, and they're going to be anterior to the thyroid right here. First strap muscle is going to be these paired little muscles here, very superficial. They're going to be referred to as the sternohyoid muscles. Just below those, posterior to those, we have the sternothyroid muscles. And then Posterior to those and a little more lateral, we have the omohyoid muscles. So those are what are gonna comprise our strap muscles. In addition to that, we have these big, thick muscles here on either side of the neck, also anterior, and those are going to be our sternocleidomastoid muscles. If you took me for patient care, you might remember that as a muscle we use as a landmarker to try and find our carotid pulse. So that's going to be our anterior muscles for the thyroid. Posterior, easy peasy. The only thing I want you to know are these muscles back here. These are our paired longus colli muscles. All right, so that's pretty much it for thyroid anatomy. Let's take a look at this ultrasound and see what we can identify. This is a transverse image of the thyroid. We have our right lobe of our thyroid, left lobe of our thyroid, that little isthmus connecting the two lobes. Posterior to that, where we have this kind of dropout shadow, that's going to be the trachea. Lateral to both lobes of the thyroid, we're going to have the cross-section of our common carotid arteries. Lateral to those, we'll have our internal jugular veins. We can't really see the left one over here, but it would be lateral to that. Then for our anterior neck muscles, most anterior superficial are going to be the sternohyoid muscles. It's kind of difficult to delineate between the strap muscles. I tried to do the best I could here. We have our little omohyoid muscles, and posterior to that we have the sternothyroid muscles. Lateral to those we have our big hypoechoic muscles here. Those are our sternocleidomastoid muscles. And we can't really see our longus colli muscles, but they're going to be kind of like a triangular shape posterior to the lobes here. All right, stay tuned. Next, we're going to talk about thyroid physiology.